The pelvic floor is a group of muscles that every human has. Men, women, children. If you have a pelvis, you have a pelvic floor.
I now have a little bit of deeper understanding, but I'd love to kind of dive in a little bit deeper of how pelvic floor therapy could help something specific like constipation.
Everyone thinks they're weak, whether they have leakage or not. And I like to use the analogy of a stuck drawer. If you just keep trying to pull a stuck drawer out, you're not going to get anywhere. You have to push it back in and then it'll come out better, right? It's kind of the same thing with the pelvic floor in that we have to lengthen before we can strengthen it.
Hello, everyone, and welcome back to another episode of Wellness for Life. I'm your host, Niki Wolf, and if you are listening and you have ever experienced leaking when you laugh or sneeze or struggling with constipation, pelvic pain, these are common, but they're not normal symptoms, and you don't just have to live with these. So today we're going to discuss a conversation with Dr. Mariah Lohr, a physical therapist who specializes in pelvic health. So she's here to break down what pelvic floor therapy is, who it can help, and why caring for your pelvic floor is essential for your overall well-being. And we will also be exploring how preventative care can help you stay ahead of these issues. So if you've ever wondered about pelvic floor therapy and how it can change your life, this episode is for you. So our guest today, Dr. Mariah Lohr, a doctor of physical therapy and co-founder of Nomadic Physical Therapy. She specializes in treating pelvic health conditions for both men and women, helping with issues like incontinence, constipation, pelvic pain, sexual dysfunction, and prenatal and postnatal rehab. She's passionate about breaking down barriers to high quality, proactive physical therapy and helping people live their healthiest, most enjoyable lives. Thank you so much for being here, Dr. Mariah.
Thanks for having me, Niki. I'm excited to chat.
Absolutely. I mean, I know that this is something that I've struggled with my first pregnancy, this pregnancy. I think it's a pretty common thing. And I think a lot of people experience some of the symptoms, but maybe don't connect it back to pelvic floor. So I'm really excited to kind of explore this conversation. But I always like to start with the basics. So what is the pelvic floor and why is it so important?
Yeah, absolutely. So the pelvic floor is a group of muscles that every human has. Men, women, children. If you have a pelvis, you have a pelvic floor. So it's the muscles that connect your pubic bone all the way to your tailbone. So if you're watching, I do have a model here so you can see it. So they wrap from the front all the way to the tailbone, and then they do spread out to your sits bone. So those two bony parts you can feel when you're sitting down. I like to kind of refer to them like a hammock. They have a lot of functions down there, okay? So the outer portions are the ones that are important for sphincteric function, which allows things to come out or go in your body. They're also important for sensation. So like when you're sitting down, you're aware of sitting on your bottom. And they're also important for sexual function. They have to engorge with blood flow in order to be pleasurable and let you participate in a sexual manner. The inner portions are the ones that are more important for support. So they support our delicate organs. They also help stabilize the bony pelvis for stability. And then because they are skeletal muscles, they contract and they relax like all of your other muscles. So when they do that shortening and lengthening action, they serve as a pump to pump lymphatic fluid and blood flow in or out of the area. So they can do a lot of different things. But the thing is a lot of people don't even know, one, that they have them, or two, what they do.
Yeah, no, that's a great explanation. I'm curious too, does it look different? Is the anatomy different based on you being a woman, a man, and even as women go through changes through, pregnancy, how does the structure differ, if it does?
Yeah, so we're more similar than we are different. Obviously, the genitals are different. The organs are different. Females have two additional muscles that males don't have around the urethra. But aside from that, the basic muscular structure is very, very similar. Of course, there are changes as we age through life, particularly for females when we start to lack estrogen, entering perimenopause and menopause. The structure itself doesn't change, but the tissue integrity might, because we're lacking that estrogenation of the tissue itself. And so that can affect our function a little bit. It's why most people in their menopausal years start to complain about some leakage here or there, or urinary tract infections being more frequent, things like that. But that's also being in a very reactive medical system. I think a lot of those issues could be prevented if females got pelvic floor therapy earlier on in their life.
Okay, great. And you mentioned estrogen. I know estrogen has a lot of different roles, but in regards to maybe the strengthening of the pelvic floor or just anything down there, what is estrogen's role in pelvic floor?
Yeah, the pieces that I look at are more like the tissue integrity. So like when I'm doing an assessment, a visual assessment, we should see that the tissues look lubricated. There should be some moisture there because that shows me that it's properly estrogenized. So if I'm seeing any like redness or tissue irritability, people are telling me, it's been really itchy or just uncomfortable, that's my sign like, oh, well, if the other things are adding up, that we're in perimenopause, we've experienced some other changes, this is probably more of a tissue issue, an estrogenation issue, versus like the muscle itself having a dysfunction.
Okay, perfect. And in regards to those are kind of some of the symptoms we might experience, but what are some of the other common symptoms, again, male and female, or if it's combined, that there might be something going on with the pelvic floor?
So this is where I actually like to step away from the pelvic floor for a minute. Remember that we're one connected body, right? Oftentimes we like to think of things in black and white, like it's just a shoulder issue or it's just a pelvic floor issue, but you're one human. So when we take a step out from the pelvic floor, there's a lot of muscles and structures that connect into it. For example, I'll bring my little model back here. Your abdominal muscles are wrapping down from your sternum all the way to your pubic bone. So they connect right into that pelvic floor tissue. Your back muscles are wrapping down your spine around your pelvis into your glute muscles, and those glutes are attaching right into your pelvic floor. From the opposite side, we have your inside thigh muscles coming up, and they attach right on this pubic rami. And so you can see we have to take more of a global approach. I can't just look at the pelvic floor to know how it's functioning. And then if you take one step out from that, this is where it gets really interesting in my opinion. There is evidence to show that your jaw and your vocal cords, your diaphragm, which is your breathing muscle in your rib cage, as well as your pelvic floor and the arch of your foot are all connected. So literally from head to toe, you are connected via fascial lines, your nervous system, and then even just the way that those specific areas are structured. They're all dome-like structures, and so they all function in similar manners.
Interesting.
So to get back to your question, a lot of different things could indicate, hey, maybe there's a pelvic floor issue at play here. One of the examples that comes to mind is if someone's telling me they have leakage, incontinence of any kind, that could mean two different things. Well, it could mean a couple different things. It could mean that their pelvic floor muscles aren't strong enough to close and withstand the pressure of their bladder. That's where most people think they have an issue, but that's actually the minority. On the opposite side, if your muscles have too much tension, they are now overly contracted through the day. And so say you cough or you sneeze or you jump and we need these muscles to contract, they're tired already. They can't be as powerful as they need to be, and so you may leak a little bit. Or it tries to contract more, but it can't. It's already at its end range of motion, and so once again you may leak. So two people who have leakage could have two very different reasons for that leakage. And this is where an assessment is really important, because I may ask this person with leakage some questions like, what are your stress levels like? If someone is experiencing anxiety, high stress, or they're like, I'm always clenching my jaw, I'm always tensing my shoulders, now I know they're probably someone who holds a little more tension in their pelvic floor muscles as well. One of my favorite examples for people is if I'm working with someone who's having bowel issues or constipation, I'll have them watch their toes the next time they go to have a bowel movement. I want to know what's going on with your feet when you try to have a bowel movement. Think about it. If you curl your toes really tight right now, what is your anus doing?
Yeah, I feel like everything's tightening. Like even my
Everything's
glutes are tight. Yeah.
clenching, right? So if you're on the toilet straining and you notice yourself curling your toes, that is not going to help things to pass through the rectal canal, right? So we need to relax our feet. We need to relax our jaw so the anus can open and you can have a bowel movement easier. So it's things like that where we really have to take more of a holistic approach to pelvic floor care. We don't always have to just focus in on the pelvic floor to make an impact.
I love that so much. I'm doing a ton of digging on just conventional versus functional. And it sounds like you very much take a functional approach of one, looking at the body as a whole, because all of it's interconnected. To your point of like your jaw can, be involved with things in your feet. And all of it is so important. And I look at even like blood work. I'm reading a book right now where it talks about if you just look at the thyroid, that's like if you're playing poker and you just look at one card. Yeah, that might be a good or bad card, but you don't know the rest of the hand. And so we really need to look at all the other factors that are involved. And so that makes so much sense. I mean, I also, clearly I'm not a pelvic floor expert, but I can imagine if your core is weak and if your back muscles are weak, how you think you might have incontinence, but it maybe could be some of those other muscles involved or the inner thigh muscles involved, that could be a contributing factor. And it comes back to having an expert who's trained in this to give you that initial assessment, because a lot of times we want to like walk our way through some of these answers and Google everything. And I think, there's a lot of value and information in there, but at the end of the day, sometimes we just need that expert opinion. And I think very much a functional based opinion, so that we can see that bigger picture. So you mentioned too, and we're going to dive into kind of what you call the 3 pillars of pelvic floor therapy. But just right off the bat to kind of pull people's attention, I know that there could be a variety of symptoms, but some of the most common symptoms of maybe a weakened pelvic floor or other interconnected thing, constipation, leakage, maybe sexual pain. What are some of those other just common ones that you've experienced with your clients?
So not necessarily just the weak side, but just dysfunctional, I would say, like whether you're overactive or underactive or a mix. Issues would be leakage, pelvic pain, pain with intercourse, bleeding after intercourse, that there's no reason for it. But then also like groin pain, chronic hip pain that hasn't gotten better with like orthopedic interventions, back pain. 95% of women who experience low back pain actually have pelvic floor dysfunction, but whether or not they know they have the pelvic floor dysfunction is another question. So
Yeah.
95% of women, that's
wild. Okay, so now that you've kind of given that information of, okay, we don't just look at the pelvic floor, we look at all these other factors. I'm curious too, what would you say the percentage of your clients, like it is the pelvic floor, like that muscle versus some of these other contributing factors?
I mean, I can't give you a percentage, but frequently, so my husband is also a PT. He's specialized in orthopedics. And we love working together because he will assess someone who just has knee pain or hip pain or whatever they thought. And as he's asking questions, he'll be like, "Hey, I got a patient for you. This one's all you. It's outside of my scope." Now, my training and most pelvic health therapist training is in orthopedics. And then we do additional training for the pelvic health side of things. So your pelvic floor therapist should take a more holistic approach. If you had a major ankle surgery, I need to make sure that ankle issue isn't causing a pelvic floor issue, right? Like if, say you're a little bit off kilter because of the ankle issue, that is going to set off your foundation. And now maybe there's an issue in the pelvis because of the ankle, right? So it all draws back to, again, we got to look at the whole body. But yes, it's pretty common that what we think is an orthopedic condition could contribute to the pelvic floor condition or vice versa.
Yeah, no, that makes sense. I mean, the more information I read on all kinds of health concerns, how everything is so interconnected. So we have to look at the big picture of everything. Now, kind of diving into these 3 pillars. So urinary, bowel, sexual dysfunction, or sexual function. I'd love to dive into what do you mean by those?
Yeah, so not a lot of people know what's normal for function, right? You know what your normal is, but is your normal, right? So I like to clarify with people when it comes to urinary function, if you're sufficiently hydrating, you're not under hydrating or over hydrating. A normal amount of times to go to the bathroom in a day is about every 3 hours or so, which should in waking hours come out to about 5 to 8 voids or urinations.
Unless you're pregnant, then it's
Unless
every
you're
3
pregnant.
minutes.
Yes, and you have a baby. At nighttime, 0 to once, getting up once would be normal if you're under 65. If you're over 65, 1 to maybe 2 times running to the bathroom is normal. Obviously, this is dependent on, did you drink a bunch of fluid right before you laid down in bed, right? But to the average person with average hydration, that's what's normal. And when you urinate, it shouldn't be painful. It shouldn't burn. You shouldn't feel like you have to force it out. It should be a very passive process where you sit down and it just happens for you. When you're done, you should feel like you emptied. It shouldn't feel like you have to go again 2 minutes later. And there shouldn't be any dribbling or, leakage when you're trying to pull your pants up or things like that. Okay, so that's basically normal for urinary function. When we look at bowel function, things vary a little bit more on this. Research says normal could be considered 3 bowel movements a day, all the way to a bowel movement every 3 days. So that's quite a spectrum of variety when it comes to bowel movements. My goal with my clients is to try to have them have a bowel movement at least once a day. Most people feel better when they can empty once a day. But regardless, when you do have a bowel movement, you should feel like you've fully emptied. And once again, it shouldn't feel like you have to strain too hard or push so hard that you're going to pass out or pop a blood vessel. You should be able to sit down and just start breathing and it pass for you. And so then for sexual function, normal is no pain unless you intentionally are asking for something to be painful, and there shouldn't be any bleeding or tissue irritability following intercourse or penetration.
Awesome. Now, so I kind of want to hone in on a certain condition. So, for instance, constipation. How can I remember when we first started talking about it, I'm like, okay, how can these be connected? And I now have a little bit of deeper understanding, but I'd love to kind of dive in a little bit deeper of how pelvic floor therapy could help something specific like constipation.
Yeah, I actually enjoy working with people who are extremely constipated because it's life-changing when the changes are happening. My proudest patient to date is a gal I was working with. She was a mom of 4, but she was also like an army trainer. Like she would take people through training if they were in the army. And so she was working out all the time. She's a very fit woman, but she would only have a bowel movement like once every 12 to 14 days. She was so uncomfortable, especially when she was working out. And so, we worked together for a few months and we got her to the point where she was then having a bowel movement once every 2 to 3 days. So not, the norm maybe of once a day, but for her, that was life-changing. She felt so much better. When it comes to constipation, the bowels can be very complex. There's the microorganism side of thing, the microbiome. There is even the nervous system side of things, right? Like we know if we are super stressed out, some people react by getting the runs. Other people react by getting constipation. Our bowels are highly connected to our nervous system. So when someone's in pelvic floor therapy and we're looking at bowel movements, we want to make sure that some of these variables are optimized. For example, hydration and fiber consumption. A lot of people don't know that there's different types of fiber and they don't know you should get about 30 grams of fiber a day and things like that. So we do chat about some of that stuff, but we also talk about toileting habits. Some people have heard of a squatty potty and some haven't. But the way that the pelvic floor is designed, one of your muscles is basically like a sling that wraps around your rectum. And it's a good thing because it prevents us from losing fecal matter throughout the day, which is fantastic. But when we are trying to have a bowel movement, we want that muscle to relax so we can empty a little bit easier. And so that's where the squatty potty comes in. It positions your pelvis at an angle that helps that muscle relax even more. So I always tell people you don't even have to buy a squatty potty if you don't have to. Use a trash can that's turned over or extra phone books if you still have phone books or whatever you have. You just want to get your knees a little bit higher than your hip level and that'll help that muscle relax. So that's toileting habits. And then we do talk about the nervous system a little bit. You have to be in a parasympathetic state of your nervous system in order to have a good bowel movement. So it's kind of like if you were driving your car and a deer jumped out without thinking twice, right? You would clench the wheel, probably clench your butt cheeks and hold your breath, right? That's your sympathetic nervous system kicking in. And in that mode of the nervous system, your body is just trying to prioritize your survival. It's not going to prioritize digestion and bowel movements. The opposite of that is your parasympathetic nervous system. And that's when your body gets to process your food well, gets to go ahead and have a bowel movement. You have to be in that state of your nervous system to have enjoyable intercourse, right? Anyone who knows that they've been super stressed or have a million things on their mind, you're not going to have a good bowel movement, right? None of us have good bowel movements in a public restroom, and it's because of that nervous system. It's still trying to protect you, per se. So we talk about that a lot. And then the last variable is the muscles themselves. Sometimes people can have dyssynergic muscles, which just means when you're going to the bathroom and the anus needs to open to allow things to come through, it's actually closing. And so now you have to try to strain harder to have a bowel movement. But chronic straining is what causes hemorrhoids, anal fissures, prolapse, things like that. And so we want to prevent those in any way, shape, or form that we can, especially if you notice like your child straining all the time. You know, if they're already starting to strain at young ages, they're going to develop poor habits that they carry with them, right? We also emphasize this a lot when I'm working with my pregnant gals. We want you to practice being able to bear down, but not valsalva and push 100% of your pressure on those delicate muscles, because that's going to increase, again, your risk of hemorrhoids or tearing during delivery, right? Mm-hmm. So I always have my pregnant women, I teach them how to push in a couple of different ways, and then I have them practice that in their bowel movements. Because what are you trying to do? You're trying to use your pressure to produce something, just like when you're giving birth. So all of that to say, that's kind of the variables that we encompass when we're looking at bowel function. And it is complex, but that's why you have someone like me to guide you through it.
Absolutely. And I think touching into I love all those different categories, but the nervous system, the more, again, I come back to the more I'm having some of these interviews, like everything comes back to the nervous system. You can do, and optimize everything in your life. But if your nervous system is dysregulated, chances are you're going to have issues in one or more different health concerns. Mm-hmm. So ensuring, and you mentioned kind of the parasympathetic and sympathetic. If you're not familiar with those terms, you might be familiar with like the fight or flight. And so when the deer's coming, you get that fight or flight or even freeze, where we want to be in that relaxing parasympathetic nervous system. Same as when we're eating, we want to make sure to be in that system. That's why we don't want to eat while we're driving, or why there's like chaos going on. If you're having a meal and your kid drops something and it shatters, try to take some deep breaths to get back into that calm state so that your body can function and it's not just going into that survival component. I love that you ended, or we're transitioning to the kind of the pregnancy conversation, because obviously this is a big conversation during, pregnancy, even postpartum. What are some of the things, and you mentioned maybe different types of breathing. What are some of these things that we can practically start implementing if we are a pregnancy, especially if you've had previous pregnancies where you have a lot of leakage? I feel like that's almost pretty common, but maybe it doesn't have to be as severe as what most people are experiencing.
So kind of tying back to what we talked about earlier, and how, when you're pregnant, the different areas of the body that connect into the pelvic floor are at a disadvantage, right? Your abdominal muscles are getting stretched as your belly grows. Your back muscles are getting tight because you're trying to adapt to the extra weight in front of your body. Your hips are getting tensed because your pelvis is trying to accommodate for growing baby. And so all of these things are at a disadvantage to your pelvic floor health. So your pelvic floor now is the complex on the base of your pelvis trying so hard to support all of these changes going on. And so it gets tired and it gets tight. But when you give birth to baby, if you're giving birth vaginally, the pelvic floor's job is to stretch and relax as much as it can so your uterus can push baby out. So a lot of times people look online on what they should do when they're pregnant, and they see Kegels. Kegel is just tightening of the pelvic floor muscles. So if your pelvic floor muscles are probably already tense, and now you're doing a bunch of Kegels, you are training a muscle to be strong but tense, right? But then you're going to ask it to stretch past its maximal capacity to have a baby. And so this is where we see tearing and issues and hemorrhoids, right? So what I would encourage you to do is try to cue into your pelvic floor muscles and try to get them to lengthen or relax. A lot of people can feel the contraction. That's not as hard for them. But the relaxation and the lengthening of the muscles is really tough. So you have to cue into your breath, which will cue into your nervous system and bring you a sense of calm as well. So you can kind of do it all at one time. But what I would encourage you to do is practice trying to breathe down into your lower rib cage, filling those lungs as full as you can, and see if you can feel your pelvic floor open or lengthen on that inhale. It may take a while to feel because you haven't practiced it. If it's already a tense muscle, it's going to take some time to become more flexible again. But honestly, that would be good for almost everybody to practice, whether you're pregnant or not, because we live in a world where we're always go, 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 and we're always in this sympathetic state. Or, if you live a sedentary lifestyle, you have to sit and travel a lot. Those muscles aren't getting the blood flow that they really need to thrive. So just by trying to lengthen and contract these muscles, now you're pumping fresh blood, fresh oxygen and nutrients into those tissues so they can work more efficiently.
I wonder why it's, and I'm not going to say taking this long because I'm just, having this conversation now, but it's all we've ever heard is Kegels, Kegels, Kegels. And it, to your point of like, we live in such a highly chronic, anxious environment, state of mind. Everything's tensed and locked. Like we're probably everything's very tense down there. And so to learning to relax that, and it's just like funny. It's like all up until every sort of health education or sexual education you get is Kegels and strengthening. And I can imagine that would be helpful for maybe somebody 60 or older who, especially if they're not doing any sort of like physical fitness or training, maybe it's weakened down there. But I think for the majority of us, I feel like it all has to be fairly tense, and to learning how to relax. I mean, you look at natural, home births where it's possible to have these births and it be, I'm not going to say pleasant, but not as just like screaming and major tearing. Like they can be more of these blissful moments where, you just let the body run its course, and it's able to, like, you're able to breathe through these contractions and really relax your body. And so I can imagine that a majority of us really need to learn kind of these breathing techniques and how to relax the pelvic floor instead of focusing so much on how do we strengthen it. And maybe the strengthening is through relaxing, but I guess not like contracting as much.
That's the hardest part to explain to people is everyone thinks they're weak, whether they have leakage or not. And I like to use the analogy of a stuck drawer. If you just keep trying to pull a stuck drawer out, you're not going to get anywhere. You have to push it back in and then it'll come out better, right? So it's kind of the same thing with the pelvic floor in that we have to lengthen before we can strengthen it. So even if the muscle is overly tense, if I had you just do Kegels, maybe you would get a little bit stronger, but the strength it's going to be able to give you is only a little bit. Versus if we just back up one step and we restore the length first, then you may already have the strength you need. The muscle just wasn't in an position to be able to provide you the strength you needed. So that's where it gets confusing because we, as humans, we want a classification. You're either weak or you're too strong or whatever. It really just comes down to we just got to optimize the muscle function, whether that's lengthening, strengthening. Sometimes it's just coordinating it. A lot of times people can't volitionally move these muscles because it's not something they've ever done. And when we teach them, okay, this is how you shorten, this is how you lengthen, that's it. That's all they really need.
I feel like it's bringing attention to it. Like so many people probably have never even thought about it. And kind of before we transition to the next thing, I'd love for you to just walk us through once more of like, if somebody's listening, they're like, okay, how do I actually do this? Like walking through somebody who's maybe never done this before, as far as relaxing the pelvic floor. And I think you mentioned lengthening. Like what are some of those verbal directions that you would provide?
this is where something different will resonate with every person. So I'll try to just give you a few examples.
Perfect.
I like to imagine a balloon. If I was holding a deflated balloon right here, so it's hanging down. When I inhale and I fill my lungs with air, I'll also see my belly and my pelvic floor fill. And then when I exhale, all of that recoils, just like the air leaving the balloon. That visual works for me. For other people, a visual that works for them is imagining like a flower blossoming. So as you inhale, let the flower bloom, and as you exhale, the petals can come back together, kind of a thing. For males, when you inhale, it would be like you're trying to lengthen the penis, and when you exhale, you're trying to pull the scrotum up, sort of a thing. Like I said, it can take some practice. Most of my clients, it takes about 2 weeks of just practicing that sequence until they're like, okay, I think I maybe got it now. So don't get frustrated if you don't feel it at first. Using a mirror can be helpful feedback. Or if you're in the comfort of your own home and you just want to rest your hand on the perineum to see if you can feel a little bit of movement, that can be helpful too. And practice it in different positions. Gravity can make a big difference. So if you're sitting right now and you're like, I can't feel anything, lay down. Take gravity out of the equation and try it in that position. Try it on your hands and knees or try it standing and just see if you can connect better that way, at least when you're starting.
Fantastic. Those are great recommendations. Now, in regards, because I can see how much having somebody who specializes in this, especially at least for the very beginning, where you can get an analysis of what's going on with your body, some tips and tricks on how to go about it. Where can somebody find a pelvic floor therapist, and are there any sort of specific credentials they should be looking for?
Yes, definitely. Everyone wants a quick fix, right? We all want to make the most of our time and money, and I'm all about efficiency too. But I do recommend that you vet out your provider, right? Just like there's excellent dentists and there's the ones you don't want to go back to, it's the same thing with pelvic floor therapist or just physical therapist in general. So do some research, ask them questions, send them an email before you make an appointment. They should be able to answer questions for you. The one thing that I like to just kind of draw attention to is there will be people out there that say they're certified to treat pelvic floor therapy. See if they've done the specialty training or if they've just done like a course on it. So there's a couple different certifications out there. There's the Pelvic Rehabilitation Practitioner Certification, PRPC for short. That's the certification I have. And then there's also one called the WCS, the Women's, I don't even know what it stands for. It's through another company. But those are the two recognized board certified specialties in pelvic health right now. And it could be an occupational therapist or a physical therapist that has those certifications, and that's totally fine. I try to just warn people, there's a lot of programs out there. We live in this world of Instagram, right? Where there's a lot of influencers who have this, get your body back after pregnancy program or whatnot. And yeah, for $20, that sounds like a great deal versus going and seeing a specialist, but keep in mind, you're an individual who had all these different variables occur. They're not asking you about your past medical history. They're not asking you what your current symptoms are. They're trying to give you a Band-Aid solution that they've given everyone else who bought into it. So just be careful, especially if you did have complications or a medical history. If you really want the full assessment, find someone who's certified in pelvic health, and they'll be able to do that for you.
Fantastic. And you mentioned too, being proactive, emailing the facility or the doctor, the practitioner ahead of time with some questions. What might be some good questions for them to ask to be able to kind of sift, this is the right person, I want to move forward, or I want to keep looking somewhere else?
Do you have a private treatment room? Would be my first question. I used to work in a clinic that wanted me to treat people behind a sheet. I wasn't comfortable doing that, and I don't think my patients would have been comfortable with that either. The private room thing isn't as important. I would just encourage people to consider a few things. How much experience does your pelvic floor therapist have? How long have they been working in the field? Have they worked with the condition or the symptoms that you're experiencing? Also, do you need a referral from your provider to see them? Every state is different. Here in Tennessee, no, you don't need a doctor's referral to come see me. If you're having an issue, you can just contact me and get an appointment set up. And then if I see something that I'm like, oh, you should probably have medical assessment for that, I just refer back out to the doctor. So it just depends by state. And then you can also ask them if you're someone who'd like to have someone you know with you in the room, ask if you can bring someone along with you. Or if you're not comfortable doing a pelvic exam on day one, you can talk to them about that and see if there's an alternative. There usually is, but you can at least
Perfect.
express those
Great.
interests. Yeah.
Awesome. Thanks for lining those out because I think a lot of people will be curious on those questions. Now, for those interested in pelvic floor therapy, whether it's out there in Tennessee or just any work that you're doing online, where can people find more information about you and your practice?
Our practice you can find on www.nomadicpt.net. We also have an Instagram page, just nomadic.physical.therapy. My husband is a comedian at heart, so he comes up with some funny videos, and then I try to make them appropriate for the internet. So you can find educational videos, but also some funny videos on our Instagram as well. But if you are, outside of the state of Tennessee and not sure where to even find a pelvic floor therapist, check out pelvicrehab.com. They have like a find a pelvic floor therapist near you feature. And so you can put in your zip code or your city, and you should be able to find someone nearby.
Fantastic. Well, this was such an informative conversation. I think we've touched on so many different topics, and I love understanding the functionality of your entire body, how everything is so interconnected, and kind of to be aware that it might not just be leakage that is an indicator of poor pelvic health. So I think this was fantastic and just provided a lot of value. So thank you so much for being here, Mariah. I appreciate your time.
Absolutely.
All right. Take care.